Hi, my name is Sharuma Islam, and I will be discussing the effects of cognitive behavioral therapy on depressive symptoms. The purpose of this literature review is to examine the efficacy of cognitive behavioral therapy on depressive symptoms in adults to yield better patient outcomes. Significance of the problem. In the United States, approximately 17.3 million adults aged 18 years or older have had at least one major depressive episode in 2017. Of those individuals, 64% of adults have had severe impairment. Healthy People 2020 objective for depression under mental health and disorders is to increase the proportion of adults 19 years and older that are screened for depression during their primary care physician office visits. Integrative literature review. Literature review conducted for the research question in adults, how does cognitive behavioral therapy compared to treatment as usual affect depressive symptoms within 6 weeks? Databases searched were EBSCOhost and Sinhal using the keywords cognitive behavioral therapy, depression, depressive symptoms, and adults. 17 studies were found meeting the criteria based on the keywords searched. However, only 3 studies were selected. The first study was a level 1 study of meta analysis and systematic review by Karyatoki et al. In 2017. The second, a level 2, which is a randomized controlled trial by Buntrock et al. In 2015. And the last, a qualitative study conducted by Hulst et al. In 2017. Only studies that supported the efficacy of internet based cognitive behavioral therapy, or ICBT, and depression were selected for the study. Level 1 Meta Analysis and Systematic Review. Karyatoki et al. 2017 investigated through a systematic and meta analysis the effect of self guided ICBT in treating adults with depressive symptoms compared with care as usual and evaluated the moderating effects of treatment outcomes and responses. The study included 3,876 participants who are adults and older than 18 years of age with depressive symptoms based on self-reported depression scales. Findings of the study concluded that self-guided ICBT was significantly more effective than controls on depressive symptoms severity and treatment response. Adherence to treatment was associated with lower depressive symptoms and greater response to treatment. Individual participant data from 3,876 adults showed that internet-based cognitive behavioral therapy was more effective compared to controls, and adherence to the treatment predicted better treatment outcomes within the experimental condition. Level 2 Randomized Controlled Trial. Buntrock et al. 2015 examined the effectiveness of web-based self-guided ICBT for subthreshold depression during a randomized controlled trial. The Center for Epidemiological Studies Depression Scale was used to rate depression before and after ICBT. 406 participants from the general public met the criteria for the study based on their CESD scores. 203 of those participants were randomly put in an intervention group of ICBT, while the remaining 203 participants did not receive any interventions. The intervention group showed statistically significant reductions in depressive symptoms severity indicated by post-treatment scores and the CESD compared to the control group. The likelihood of seeing a treatment response was twice as high in the intervention group compared to the control group. Qualitative study. Hulst et al. 2017 conducted a qualitative study to explore primary care patients' experience of internet-based cognitive behavioral therapy for the treatment of depression. 13 participants were chosen from primary care centers in southwest Sweden that were 18 years or older, diagnosed with mild to moderate depression, and randomized to ICBT or treatment as usual. Focus group discussions and individual interviews were conducted. Data was analyzed via systematic text condensation in developing descriptions and concepts concerning experiences. The results concluded that patients felt that although ICBT was an effective tool to treat depressive symptoms, they described a need for face to face meetings with a therapist. A therapist who performed checkups and supported the ICBT process seemed important. Application to evidence based nursing practice. The application of ICBT can be implemented by the advanced practice nurse in the outpatient setting of psychiatric hospitals and offices. Findings from these studies can be applied to improve nursing practice in that patients can have ICBT as an alternative to psychotropic medications, reducing side effects and long term dependence. ICBT can be utilized in the privacy of the patient's home and increase adherence to treatment. It will cost less money as patients are less frequently visiting emergency rooms or psychiatric hospitals. Follow ups with a therapist can also help the patient stay on track. Conclusion. Internet based cognitive behavioral therapy is a great and effective tool to treat depression in adults. It allows the patient to take charge of their mental health. ICBT in treating depression in adults can reduce the number of the prescription drugs an individual may need. Knowing what treatment options really work in treating depression allows the healthcare provider to create an individualized treatment plan and avoid over medicating. And lastly, the delivery of ICBT over the internet might be a promising strategy for the dissemination of psychological interventions for depression on a larger scale.